you, everyone. I would like to ask if Dr. Nathan, if you can carry on with the legend interview that we have from the previous session with Dr. Michael Steinmetz. He has joined us, if you may.
Yes. Hello, everybody. Thank you for allowing us this opportunity to continue with our and finish our session. Dr. Steinmetz, are you here?
I am here. Yes, thank you.
Perfect. Thanks. So I'll be interviewing you from my car because I just got called into the hospital, but we can still make it work.
Perfect. And I,
Um,
I, I apologize. I did not have my time zone corrected to the correct time zone to the meeting, I think, and I apologize deeply.
Not a problem. It's good that we still had the chance to do this. So I have a few questions for you just to get a general idea about what what drew you to neurosurgery and to research specifically. What what would you say initially drew you to neurosurgery and what later inspired you to pursue research within this field?
Sure. No, it's a great question. I think what drew me into neurosurgery early on is my wife's father, my father-in-law, who we've been together since would be high school here in the US. So since around 12th grade 12, I was around him during that entire time, and he was a practicing neurosurgeon who had a lot of influence on me during my high school year, during my early college years, and then going into medical school. And in fact, it was something that I was not interested in going into medical school. And it wasn't as I got into my classes in neuroscience and seeing what opportunities were out there. It seemed like we knew a lot about everything in the body to some extent. But the brain and the spinal cord, et cetera, was so little explored. There was so much opportunity, and we could have such a big impact on that, not only from the neuroscience standpoint, but then also from the surgical standpoint. So I think my early experiences with my father-in-law, his influence on me, and then I think really diving into the neurosciences in medical school and the idea of exploration, I think is what got me into that. There was so much unknown, and that is probably what, going into your second question, that's probably what influenced me to also get involved in research, early on, is really trying to answer a question around something we don't know, right? What is some area that we just don't truly understand, and can we work on that and try to have an influence? And I think it goes back to something somebody once told me is they said, look, everybody can become a good surgeon. Not all of us could become Dr. Spetzler in that type of skill, but all of us can become good surgeons, and we probably leave impact on, individual lives along our career. But I think a big impact we can have on this field is discovery, make, and research. And I think that really stuck with me. And so that has probably led me to continue to pursue research all the way through my professional career.
Okay. Well, that's a very, very interesting take on the subject. So you started with a very big coincidence, simply that you got into the field and then had such a personal attachment. Then that's very nice. Well, then I'll ask, what is there a particular research project that stands out in your career that was specifically impactful or that you had such a personal relationship with, if I can say it that way?
Sure. No, that's great. There's probably many, but I think the one that sticks out is an area that I'm continuing to research currently. And I've got to tell a little bit of the background story how I got involved, but I'll keep it brief because I know this interview time is brief. But when I was a fellow at the University of Wisconsin, I worked with an orthopedic pedigree spine surgeon, one of my mentors, Paul Anderson, and he was talking to me about a disease that I had never heard of in my entire life called Bertolotti syndrome. We had a case of it with him. I never heard about it once during my training. It just sort of went in one ear, out the other ear as a fellow. I thought it was interesting. And then when I was in first year into clinical practice, my partner, who is more of a medical spine physiatrist, asked me had I'd ever seen a condition like she was showing me on this X-ray, CAT scan, and MRI. And I said, "Oh yeah, that looks like Bertolotti syndrome." And so she said, "Do you want to see the patient?" And I did, and I saw him, and I ended up operating on him. Long story, after conservative therapy, and I did it minimally invasive, and I wrote a paper about this. Okay, this was in the early 2000s, and I wrote that paper. Then I started to see some patients that were coming from all over the United States, some all over the world, to come see me for this condition that nobody was really treating. So as I was seeing these patients, it struck me that we really don't know why this condition has pain. Like, does it really cause pain? It's a common thing we see incidentally on X-ray, on CT, MRI. And if it does cause pain, how? So we developed in our lab, we developed a biomechanical model of the lumbar transitional vertebrae. We started to study sort of the biomechanics, the kinematics, and now the kinetics, the force generation in a variety of clinical scenarios. And with our model in our biomechanics lab, we can study not only the condition, but we can also study different treatment modalities as well. And so we continued to do this. And then I started to think, well, are there differences in this histologically? So we started a prospective study and we started to take samples of the joint. There's a pseudo articulation of the last and large transverse process with the sacrum called Bertolotti syndrome. We started to sample the tissue in and around that and send that to pathology and try to understand that. We did MRI analysis of the ligamentous structure to the lumbopelvis, trying to understand that. And what I want to summarize with this and why this sticks out is it was an opportunity to study something that was not very well studied at the time, right? And what I think we're trying to do is try to uncover sort of step by step of this condition, of this anatomical arrangement, and trying to understand, does it cause pain? And if so, how? And then more importantly, what do our treatments do to this and how do they influence pain? So by no means am I saying that we are the ones leading in this discovery and all of this, but I just think it's a unique period of time in my life where my mentor had introduced a clinical condition to me that I'd never heard of. Then I saw one, and then we said, okay, now let's go study it. And we continue to study that and publish on it today.
Okay, that's it's very beautiful in a sense. These small coincidences that you've gone through and that have been able to shape your career and your life in so many different ways. So just it goes to show how much you can achieve with if you have the right coincidence and show curiosity and openness to the subjects. Very nice. I think so. Our time is almost up. I have one last question for you. If just in a few short words, you can explain what advice would you give to young neurosurgeons eager to engage in research, especially in resource-limited settings? What advice could you give? Well,
Yeah, I mean, that's a great.
Give us also as a young neurosurgeon.
Yeah, I mean, I think it's a great question. One is I think you have to be curious and stay curious. Once we lose our curiosity, I think our ability to innovate and to do research goes away. So always ask why. I think that's the number one advice I could give to somebody. I think that you should partner with somebody perhaps that is engaged actively in research. Try to see how they do it. How can they obtain the resources, the skills? Maybe go out and learn skills that you may need to do that. Now, in resource-limited countries, it's a little bit limited. I know our time is running short, but I think it's going to organizations like the World Federation of Neurological Surgery with the research committee, where we're trying to provide partnerships, perhaps with people with ideas, with larger laboratories that have the resources and time, and maybe even provide some of those centralized resources back to them. So I know it's a roundabout question. So first and foremost is be curious, stay curious, ask the questions why, and then seek out mentorship and opportunity wherever it exists to try to answer some of those questions going forward. And it is tough when resources are challenged. So then I think it's working through organizations like WFNS to try to connect with other groups, bigger groups that have those resources that can partner with you. And now with the digital age we work in, sometimes a physical connection doesn't have to be there. It can be a digital connection to make that happen as well. Perhaps that is how we, take this forward in areas where there's limited resources.
Hey, that's very nice. So be curious, stay curious, and stay open to opportunity.
Absolutely.
Very good words to part with then. Thank you very much, Dr. Steinmetz, for joining us for this interview. Thank you everyone at the WFNS for giving us the opportunity to present this interview. And then now we'll give over the hand to the next session then.
Thank you so much as well.
Thank
And sorry
you.
for being late. I apologize.
No, that's okay. Thank you, everyone. Thank you for the wonderful session. Thank you to the speakers and Dr. Mehmet and Dr. Marker for moderating this session. Now, let's move on.